All right, so next up we're going to go over the hip and the pelvis. So the hip will cover the sagittal plane, and the pelvis will cover the transverse plane primarily. Okay, so this time the right limb is going to be our reference limb, and we have a little marker on the hip. So pay close attention to that. First up, we have initial contact here. So the hip is going to be in about 20 degrees of flexion. The pelvis is tilted anteriorly about 10 degrees with 5 degrees forward pelvic rotation. So if you're looking from the top down, it'll look counterclockwise rotated with the ground reaction force anterior to the hip joint. Okay, moving into loading response. So we have about 20 degrees of hip flexion again with the same 10 degrees of anterior pelvic tilt. Pelvis is rotated anteriorly 5 degrees. Ground reaction force is anterior. So we have sort of a hip flexion moment going on in these initial gait phases. As we move into mid-stance, the hip is going to be in neutral, so neither flexed nor extended. The pelvis is still tilted 10 degrees anterior, but now we've decreased the pelvic rotation, so it's going to be kind of neutral in the transverse plane. And the ground reaction force is posterior, so it's now shifted back. We now start to have an extension moment at the hip. Okay, terminal stance. We now have hip extension about 20 degrees. The pelvis is still tilted 10 degrees anteriorly, but now we have a clockwise or backward rotation of the hip by about 5 degrees. So when the reference limb is trailing the contralateral limb, the pelvis is going to be rotated backwards versus when it's swinging forward, then it's going to be rotated anteriorly or forward. Moving on to pre-swing, we're still in hip extension, but it's a little bit less as we start to kind of bend the knee and flex the hip. Pelvis is still in neutral. It's going to have the same 10 degrees anterior pelvic tilt, but the ground reaction force is posterior still. As the hip starts swinging forward, basically the legs starting to catch up with the contralateral side or the stance side. So we have about 15 degrees of hip flexion. Pelvis is still tilted 10 degrees anteriorly, and the hip is catching up. So it's still rotated a little bit backwards, about 5 degrees, but it's going to be heading back in the opposite direction. And since we're in swing phase now, we have no ground reaction forces acting on the reference limb. They are on the opposite side. In mid-swing, we now have more, 25 degrees of hip flexion, same 10-degree anterior pelvic tilt. At this stage, mid-swing, the limb is now passing from posterior to anterior, so we have neutral transverse rotation of the pelvis. And finally, we have terminal swing in preparation for initial contact. The hip falls from about 25 to 20 degrees of flexion. Pelvis is rotating forward 5 degrees, like I said previously, and the 10-degree anterior pelvic tilt remains the same. And that is hip and pelvic kinematics. Thanks again for watching. We'll see you for the next one.